Is a dreadful disease that is rarely associated with the young. It is also usually misperceived as a sentence to death once diagnosed with one. But that's not entirely true. The young can acquire and survive cancer. Now our reporter ZAHRA ABIGABA brings you the insight on what causes cancer in children and how some parents cope up with treating their children.
Uganda Cancer Institute is the word for childhood cancer. It's a specialized unit that manages all types of cancer in children across the country. The department is headed by Dr. Joyce Balagade Kambugu, a pediatric oncologist. The most common cancers in children include leukemia, lymphoma, rhabdomyosarcoma, and cancer of the kidney. Dr. Balagade reassures Ugandans that the Cancer Institute can manage most cancer cases.
The Uganda Cancer Institute currently has the only comprehensive cancer treatment center for children.
Dr. Balagade notes that the records at Chadono Center Register indicate that the rate of cancer has increased from 400 new cases in 2015 to 490 in 2016 and 512 cases in 2017. 7,000 new cases are diagnosed among children every year. But what exactly causes cancer in children?
These are not known, which makes it very frustrating to ask people how to prevent something when you don't know what is causing it.
She notes that 80% of cancer in children is curable. And medics cite the main challenge.
That our children present to us very late with advanced disease.
Adjusting to child cancer diagnosis and finding ways to stay strong is challenging for everyone in the family and friends. Linus Okello, at 11 years, was diagnosed with leukemia in 2016, and she has been on treatment for close to 2 years now. She narrates her ordeal on a bad day.
I feel pain. I used to feel pain in the stomach. My head used to pain. I used to have the bone pains have just started this year.
Okello, at a tender age, suffering from cancer, has advice for the people living with cancer caretakers.
Would just like to tell all the people you should treat cancer early enough so that it doesn't relapse. Yes, and follow treatment.
However, cancer has not shattered Okello's dream of becoming a professional journalist in future.
I want to become a journalist.
Diagnosis of cancer can be very stressful and difficult for patients, especially among children. It can lead to feelings of despair, anxiety, isolation, hopelessness, and confusion. Connie Elaba, mother to Okello, takes us through her ordeal from the day her daughter was diagnosed with cancer.
Student Mulago, I even broke down just seeing the word Cancer Institute. I broke down. A friend called Enith came around. She hauled me up, but down the road the treatment has been tough.
One dull morning, she thought her daughter was dead.
He called me, it was like Lennis has collapsed. Reaching the hospital, I found Lennis was like dead. It was tough.
A child on cancer treatment may experience distressing emotions and mood swings as side effects of medication. Ebala notes that after 3 months into different tests and treatment, Okello's condition worsened.
Lennis lost all hair. She was not having hair. She was not having the nails. It turned to dark. It was that bad.
Bala then turned to God for mercy.
God, this is how we are going to end? Have mercy on us. We struggle. We really, really struggle. Because at times you will reach the hospital, then you'll be lacking the money for going home. Everything you have, you find you have spent everything.
Ebala asked every Ugandan to support the cancer patients at the Uganda Cancer Institute.
So with the support of others, I think they can make it. So I call upon everyone, well-wishers, come and check on these people once in a while.
But there can be light at the end of a dark tunnel. Jeremiah Ntanzi, 14 years, is a living testimony to cancer survival. Ntanzi has a special message for children battling cancer.
No matter what people tell them, no matter what, they should feel like other people. They should be strong enough. They should have courage. They should not give up on their dreams. They should not give up on education.
Ntanzi has battled cancer. He wants to focus more on his education.
I want to be a doctor, and I have a dream of I want to engage in politics.
Every day, 43 children are diagnosed with cancer. 12% of the children diagnosed with cancer do not survive, and 60% of the children who survive cancer suffer later effects such as infertility, heart failure, and secondary cancer. ZAHRA ABIGABA, UBC.
Thank you so much, ZAHRA ABIGABA, for that report on childhood cancer. One thing that stands out is that it can still be curable among children. Now, the Uganda Communications Commission has defended the ban on use of scratch cards owing to health